This used to be me before I learned how to correctly lift patients. Ooh, was I a mess.
I don't want anyone else to suffer the same way I did. So now my job is to show other nurses the proper body mechanics when lifting patients so that they don't hurt themselves.
Proper body mechanics means using the safest and most efficient methods to lift and move patients or heavy items. Musculoskeletal injuries are high among nurses because many patient care activities require nurses to push, pull, carry, and lift.
According to the CDC, in the year 2000, 10,983 registered nurses lost work days due to injuries from lifting patients. Additionally, 12% of registered nurses reported leaving the profession due to back pain. Let's go catch some nurses in the act so I can show you all what I'm talking about.
All right, Melanie. Mr. Bear is looking a little uncomfortable. Let's try to move him up a little higher in the bed, okay?
Okay.
All right. On a count of 3. Okay. 1, 2, 3.
Do you see what's wrong with this picture? 'Cause I do. Poor Mr. Bear. The bed is way too low where they're hunching over and straining their backs. What they should have done is make sure that the bed is raised up to their hips first. Also, they should have used a draw sheet to move him up instead of picking him up directly with bare hands. Let's try this again.
Let's first raise the bed and then use the draw sheet and move him up on the count of 3. All right. Okay. There we go. Okay. Ready? Yep. 1, 2, 3. Perfect. There we go.
Okay, Mr. Bear, it's time to go to X-ray. I'm gonna need you to put your arms around my neck. Bear with me. Okay, 1, 2, 3.
Are you okay, Mr. Bear? Oh, goodness, I need help.
Oh no, this is a no-no. The nurse here is too far from the patient, lifted using mainly her back, and attempted to lift the patient by herself. It is recommended that a nurse is to obtain assistance for anything weighing more than 35 pounds.
Hey, Nurse Eddie.
Hey.
So I'm having some trouble transferring the patient to X-ray. Can you come with me?
Sure, let's go.
Okay. We're gonna set you up first. 1, 2, 3. Ready? On the count of 3. 1, 2, 3. Okay.
Hey, thank you, Nurse Eddie.
You're welcome. Alright, Mr. Bear, you're back in your room. Let's get you back in bed. Alright, so let's move Mr. Bear from the stretcher to the bed, okay?
Okay.
On the count of 3. 1, 2, 3.
I hit my good head. Oh, that's okay. The bump will go away in a few days.
Hold up, wait a minute. Let's start from the top to see where these nurses went wrong. The patient's bed and the stretcher are not the same height. The nurses are not using assistive devices to help transfer, and the patient's arms are not secured. For the safety of the patient, the 2 platforms need to be leveled, the patient's arms need to be tucked into their sides, and they need an assistive device to help them transfer. Let's try this again.
Mandy, can you make the level of the bed the same as the level of the stretcher?
Okay.
Alright, that's good. Thank you.
Alright.
Alright, so I'm going to move Mr. Bear towards me and you can put the board underneath him, okay?
Okay.
Good. Alright, let's move him on the count of 1, 2, 3.
Alright, let's get you nice and comfortable. Mr. Barry, do you need anything else? It's alright.
Proper body mechanics refers to the method of efficiently facilitating body movements to allow physical mobility without muscle strain and excessive use of muscle energy. Nurses especially need to use proper body mechanics to reduce risk of injury, to be able to give the best quality of care to patients, and to increase their own quality of life long term.